This short video from Northern Sydney Local Health District is a guide to your rights and responsibilities when receiving mental health or drug and alcohol care. If you are accessing mental health or drug and alcohol services, or someone you care for is, there can be a lot to learn and challenges along the way. In New South Wales, there are rights for a person seeking healthcare, their family and carers, and knowing your rights is an important part of the journey. The Australian Healthcare Charter of Rights and Responsibilities is a guide for how you can expect to be treated. Care and support is organised around you. To reach your recovery goals, the staff will work with you and others involved in your care. On the path to achieving these goals, there are rights that are specific to mental health and/or drug and alcohol care. You have the right to be treated in a safe environment, which is best suited to your needs. So if you don't need to be in a hospital, then maybe your care can take place in the community. The right to participate and be informed about care, costs, alternatives, and treatment side effects. A team should make every effort to include your views and wishes about your care. Your care plan should be developed together with you, your family or carer, and the treating team. It needs to be a plan that everyone understands and agrees with. Every effort should be made to obtain your informed consent about your care. This means you understand what you are consenting to, the risks and the benefits. You always have the right to request access to your medical records. Sometimes a person may be required to receive care when they are experiencing increased mental distress or unsafe use of alcohol or other drugs to ensure their safety and the safety of others. At times, a person needs to stay in hospital involuntarily under the New South Wales Mental Health Act or Drug and Alcohol Treatment Act. Or there can be a community treatment order for people receiving mental health care. These decisions are always made respectfully and with the best interest of the person in mind. You have the right to choose the person that will be your designated or primary carer. This is the person staff will talk with about your needs and care with your permission. Families and carers can play a vital role in supporting recovery. There are specific rights to keep family and carers informed and involved. You should always be informed if the person you care for is absent from hospital, is involuntarily admitted, discharged, transferred, or has been made voluntary under the Mental Health Act. In mental health services, families and carers should be included in care planning and consulted if there is a hearing with the Mental Health Review Tribunal. The person receiving care or their carer can also request an official visitor to review their situation, ensuring the best care possible for the person. As a carer, you can ask for a person to be assessed for admission to hospital, a mental health CTO, or for discharge into your care. Rights are important so that people receiving care get the fairest and best care possible. Knowing your rights ensures that everyone can collaborate effectively and achieve the best possible outcomes. For more information, please look at the Australian Charter of Healthcare Rights, Mental Health Coordinating Council's Mental Health Rights Manual Resource, New South Wales Mental Health Act or Drug and Alcohol Treatment Act, and the New South Wales Carers Recognition Act. Your rights, everyone's responsibility.